So you're interested in learning about the Haitian cholera outbreak of 2010? Well, you've come to the right place. Considered to be one of the largest modern outbreaks of cholera, this spread of infection started in 2010 and persists on till this very day. But wait, you may be thinking to yourself, haven't they developed a vaccine for this already? Shouldn't it be cured? The answer to this is sort of. To understand more, let's take a closer look at what exactly cholera is.
With an estimated 3 to 5 million cases and over 100,000 fatalities occurring each year, cholera is a serious global health issue. It is spread most easily in places with poor sanitation, crowding, war, and famine, and is found more frequently in parts of Africa, South Asia, and Latin America. Cholera is an acute diarrheal illness caused by infection of the intestine with the bacterium Vibrio cholerae. People become infected when they ingest food or drink water containing the bacteria, which usually is a result of contamination with feces from a person with the infection. Once the bacteria enters the digestive system, it begins colonizing the small intestine using their toxin co-regulated pillars, which are these thin, flexible, filamentous appendages to propel themselves through the thick mucus lining, then attach themselves to the intestinal walls. Once attached to the intestinal walls, the cycle of spread and infection restarts as the bacteria begin producing toxic proteins which give their host watery diarrhea. If proper sanitation methods are not in place, the multiplying new generations of Vibrio cholerae bacteria are spread out into drinking water to be ingested by more hosts. Approximately 5 to 10% of infected persons will have severe disease characterized by this diarrhea, vomiting, and leg cramps, which when left untreated may result in fatality. Cholera spreads rapidly in communities lacking clean water supplies and sanitation. Haiti, which has the lowest rates of access to improved water and sanitation infrastructure in the Western Hemisphere, presented the perfect environment for a cholera epidemic. In 2010, the earthquake made gaps in sanitation infrastructure worse and made it more difficult to reach isolated communities and treat patients, raising the death toll. Many Haitians were forced to live in displaced person camps after the earthquake, where cholera spread quickly in unsanitary conditions.
Okay, so now we know what cholera is, but how exactly did it get into Haiti?
Originally, it was believed that cholera in Haiti resulted from environmental conditions post-quake. However, the cholera strain in Haiti is almost identical to the strains commonly found in South Asia, but starkly different from strains in climatically similar regions to Haiti. Data strongly suggests that the epidemic began with the introduction of the V. cholera strain into Haiti from a distant geographic region in South Asia. Epidemiological and molecular genetic investigations trace the outbreak back to UN peacekeepers from Nepal who came to Haiti after the earthquake. Kathmandu had a cholera outbreak on September 23, 2010, and UN troops sent to Haiti from Nepal were never screened for cholera. According to the United Nations Chief Medical Officer, no follow-up tests were done on troops due to their lack of symptoms. Nepalese peacekeepers arrived in Haiti on October 8, 2010, and the first cholera case was reported on October 12. Hospital records, field surveys, and spatiotemporal analysis data suggest that the UN camp's troops contaminated the Mille tributary through unsanitary sewage drainage systems. The Mille tributary connects to the Leighton River, which goes through the town of Mirebalais, where the first case of cholera was reported. Pipes from the camp leaked fecal waste into the river, and the company responsible for the disposal of waste in the camp was dumping waste away from its designated location.
Over the past 8 years, cholera has affected more than 700,000 Haitian people, claiming the lives of almost 10,000 by 2016. Conditions have improved in Haiti, mostly through treatments such as oral rehydration therapy. Haiti's water, sanitation, and hygiene, or WASH infrastructure, desperately needs repair, as improved sanitation is necessary to prevent the spread of cholera. The CDC, UNICEF, and the presidents of Haiti and the Dominican Republic called on the international community in 2012 to invest in rebuilding Haiti's WASH infrastructure. Currently, what is being done by the Haitian government includes construction of latrines, training of community health workers, distribution of soap and water purification tablets, and public hygiene education campaigns. This has meant a lot of local, international, public, and private dollars have been dedicated to the disaster in an attempt to remediate the effects and prevent future outbreaks. But who accepts the blame for all of this? Well, because of the UN stance on foreign policy, no one really.
The United Nations is an international peacekeeping body which provides aid in instances of peril and disaster. Consequently, to avoid the organization from prosecution which may impede their peacekeeping actions, they have international legal immunity from public law claims. This meant that when Haitian victims of the cholera outbreak attempted to bring up lawsuits with the organization, the UN claimed they were public in nature rather than private and therefore not applicable to them. This disregarded the UN's accountability and, in the public eye, undermined the rights of the Haitian citizens.
Wow, so there's a lot to know about cholera. But what about those vaccines we mentioned earlier? Do they in fact exist, and why aren't they being used? Well, there is a vaccine which can be administered orally, and some UN workers did receive it, but it only provides protection for 6 months and isn't 100% effective. As with many bacterial or viral outbreaks in developing countries, there is no one right solution. Thanks for tuning in to our channel. Leave a comment below on your thoughts on eradicating cholera in Haiti.